All right, so welcome to this presentation where we are going to talk about business models in healthcare. Why is this very important? I believe it is very important because of the fact that health challenges are quite many, ranging from accessibility to healthcare services, ranging to issues to do with the quality of healthcare, and also health disparities. So these challenges um, pose unique situations, and therefore there is need to address these challenges in unique ways. And the unique ways are the business models that we are going to talk about. Um, this sounds like it is more to do um, with business, how businesses actually operate in healthcare industry, but I will infuse in aspects to do with social entrepreneurship or social enterprises, how social enterprises address these healthcare challenges. Um, so we'll first look at the nature of healthcare services or the provision, how healthcare is actually provided, what levels, what are the unique challenges that we face, and then what are the possible solutions, and then we now bring in the aspect to do with business models. So we'll look at different business models and their advantages and disadvantages, and then we close it up with how social entrepreneurship or how public health entrepreneurship can try to bridge that gap. So that is the overview of what we are going to have. So healthcare is about the maintenance and improvement of physical, mental, psychological, social, and mental health. Basically, we are dealing with the two ways of addressing these health matters. Primarily, our interest is on prevention, but when things actually go beyond prevention, when we have a disease that has manifested, then we have to deal with how to treat it, how to manage it. So all activities that are aimed at either preventing or managing illnesses or challenges that are posed to health in whichever dimension, whether social, physical, mental, environmental, spiritual, um, all those activities can be termed as healthcare activities. So when we talk about healthcare, we talk about the provision of these healthcare services. This provision can happen at individual level, where you have a patient moving in to see a clinician, or at a community level, where, for example, community diagnosis can be performed, and then community challenges are identified and then addressed. So the interest of, for example, public health professionals is that health challenges are addressed at a population or community level. Clinicians, people who provide direct medical care to patients, to individual patients, for them they are interested in that interaction, and that is what distinguishes medical courses from public health professionals. So when we use the term healthcare system, we are referring to all institutions, all organizations, all people, and the actions that are aimed at promoting health within a particular population. Okay, so the total of all these institutions, all the people, and all the efforts or actions with the intent of promoting health is what we call healthcare system. So healthcare can be provided at different levels. If someone falls sick, they will go, for example, to a nearby clinic. That clinic can be owned by a private citizen or can be a government-owned facility. In our case, we have primary healthcare centers, primary healthcare units. These are the primary facilities of contact. So the services provided there fall under what you call primary care. And if the condition cannot be managed at that level, then the person goes to a hospital. This can be a county hospital, a state hospital, even national referral hospital. That is where they will receive secondary care. And in this case, you have them being attended to by physicians, by surgeons, and other obstetricians and other professionals, specialist professionals. Okay, and then tertiary level is where you can have high cases that are advanced and they require highly specialized care. Okay, so in these facilities, you are expected to find high dependency units, intensive care units. So the provision of services that this kind of facilities is what we are terming as tertiary care or tertiary level facility. And then we move to quaternary care. This is more advanced. They are characterized by intensive research and experimental medical interventions. So that is quaternary care. We have not yet reached that level as a country. So what are we having in what I'm terming here as low and middle income countries in terms of healthcare? Healthcare is still inadequate. The public health systems are not providing quality healthcare services, and people in rural areas are actually facing this challenge a lot compared to those in urban areas. And therefore, because of this gap, you find out that you have more facilities being owned by private owners being owned by the government, for example. But in other countries where you have, for example, the government providing much of the healthcare services, you find out that private entities are not thriving that much. Okay, so the private owners are interested in filling this gap, but also on generating sufficient revenue. And then another arm of business owners in healthcare comes in, and those are the ones we are calling the social enterprises. You can call them, actually, you can call these the social entrepreneurs. So the social entrepreneurs are the ones that own the social enterprises. What they do is that they use innovative, sustainable business models to try and address the health challenges of different communities, especially underserved communities or populations. Usually, the challenge is about how they can be regulated, how they can get licenses, and also how they link up with the government systems or the government public health systems. So that is what is happening in terms of healthcare in low and middle income countries. For countries that have moved in terms of their healthcare, provision of hospital-based care is actually not something that is being promoted. So there is a shift towards having what we call ambulatory or home-based care. Okay, someone comes for a surgery and then they go back home that very day. Ambulatory, that is, they just move in and go out. And then also, for example, childbirth experiences. where you are having a woman delivering at home, being attended to by a midwife or any other skilled birth attendant, and not necessarily needing to deliver at home. So these are trends that are actually happening, and as a result, you actually see in some countries that the bed capacity is actually reducing. Inpatient numbers are actually reducing. Okay, so we shift our gears to how customers are also influencing healthcare. We are seeing also a shift in terms of what customers expect from healthcare providers. It is, for example, in our context, we still have issues of inadequate healthcare services, even competition for healthcare services. Quality healthcare services is still low, and there is almost lack of transparency and accountability and mechanisms to make sure that healthcare organizations are interested in improving the quality of services that they provide. But of course, this does not mean that customers are not actually having higher expectations of the quality of services that are being provided. So that means that healthcare managers need to be very cognizant about issues to do with what the customers perceive in terms of their brands. One major issue also that is happening, regardless of whether we are talking about a middle income country or higher income countries, the rise in terms of medical costs. This is one of the biggest challenges that healthcare industry is actually facing, and usually you will have higher expenditure in terms of healthcare, but improvement in terms of health outcomes usually takes long to be to manifest actually. So the return on investment, which is basically improvement on health outcomes, is something that health economics find it hard to tackle. But definitely health expenses are increasing because of increasing technology, because of increasing demand from consumers, demanding for high quality services, issues to do with the costs associated with hiring highly competent and specialized health personnel, and then having to having an increase in operational costs, and many other things, issues to do with having the latest equipment, the latest infrastructure. All these are the ones that contribute to increasing expenditure in the healthcare industry. So we talked about the provision of healthcare services at the different levels. What perhaps we need to draw in now is that we can divide these healthcare services into two: those that are curative and then those that are preventive. And I think I highlighted this when I talked about the fact that healthcare services can be categorized into two, where I talked about prevention and then also treatment. So treatment is what we are terming as curative services, and then prevention, those are the preventive services. In our cases, we have many organizations interested in providing curative services. People want to treat malaria, typhoid, TB, all these. They're interested in treatment and not basically preventing diseases. Okay, so it also involves issues to do with prescription of medications that basically are used in treating these conditions. Prevention, of course, as public health professionals or healthcare professionals, we know that we have about 4 levels of prevention. Primordial, we have primary, secondary, tertiary, and quaternary prevention. So these are usually not provided by our healthcare organizations, and this is where you have the government coming in and provide these services. Issues to do with the screening, vaccinations, these are very important. So there is need to integrate them into the health system properly. Okay. So when you have a comparison in terms of curative versus preventive services, you see that most of the social enterprises are focused on curative, and that means that there is a gap that needs to be filled. Usually, of course, our populations have what we call they are low-income earners, and we are not really very aware of the importance of preventive services. So, for example, it could be very hard for you to tell someone to pay for a gym subscription if really they are low-income earners. Yet, keeping a physical, an active lifestyle is actually very important in preventing hypertension, diabetes, and many other non-communicable diseases. So that is where the challenge is. You investing in preventive services means that the revenues that you can get may be low because of issues to do with the income status, awareness, and also willingness to pay for these services. So social entrepreneurship, that's where it comes in. Having identified the challenges that healthcare organizations face, it is actually very important to fill this gap using what you call social entrepreneurship. So social entrepreneurship is aims at designing and implementing innovative products, services, and systems that address social needs. And these social needs can be in different aspects, can be issues to do with access to medicines, issues to do with access to water, issues to do with increasing coverage in terms of immunization, and many other things. They are not usually driven by the need to amass a lot of wealth. So making a lot of profits is not what social enterprises aim at. Social enterprises come in to bridge the gap in terms of if the government cannot immediately address some of these issues. Okay, so basically, social enterprises can work at different levels, whether primary or secondary healthcare levels. Okay, and that basically is also related to what we are calling as public health entrepreneurship. The public health professionals that we are training in this generation should be able to use business models that to solve public health problems in an innovative and sustainable way. Okay, that means that public health professionals need to have the skills in managing businesses ultimately, in order for their business ventures to improve health outcomes overall. So social enterprises in the area of health can actually succeed and improve health outcomes, but that success depends on how social entrepreneurs or social enterprises are actually linked to medical processes or to the public health systems or processes. That means that for social enterprises to have impact, connection with the environment, with the community is very important. Community engagement, using innovative technologies, strategic partnerships with other organizations or entities, and then cross-subsidization. These are very important principles that, if followed well, they can result into impactful social enterprises that address health issues. Having looked at the social entrepreneurship and having looked at public health entrepreneurship, how then can a professional like you design an innovative way to solve a healthcare problem, or what you are terming as a public health problem? So that means that you need to have knowledge in designing what we are calling healthcare business models. What are these models basically? These refer to the frameworks and strategies that healthcare organizations use to generate revenue, deliver services, and create value for patients and stakeholders. This looks like a very complex definition, but basically what this is all about is about what you call value creation or value proposition. What does this really mean? What value are you providing to your customers or your clients? That's the first question that your business model actually answers. Okay, and then the other subsequent questions can relate to how you're going to provide this service, and how are you going to collect money, and how are you going to make sure that it's actually sustainable. A business model basically answers those questions. Why do we use business models? It is actually very simple to communicate to different stakeholders what you're actually doing and what value they will get out of the services that you're actually giving out. Okay, so that is what we call a business model. So when we include the word healthcare business model, we're basically saying that we are describing the frameworks in which a healthcare organization provides value to its shareholders, to its stakeholders, to its clients. So how are you providing these services? Is it through healthcare facilities? Is it through a static clinic, or is it through a mobile clinic? Is it through digital platforms? How are you going to get the money? Is it through digital payments? Is it cash payment? All these are answered by what we call business models. So a business model answers those questions, but there are terminologies, of course, that we use in answering those questions. The first term that I used, which was value proposition. What is it? What is it that you're offering? What is that unique thing that you're offering to your clients? So if it is in terms of services, what service are you providing, and what problem is it actually solving? Are you providing highly affordable secondary care? Is it high quality primary health care? What is that you're providing? What value are you going to give to your clients? That's the component number one. Component number two, who are you providing this service? Your target market. Who are you interested in? Are these people that have what we call that are in underserved communities? Are they rural communities? Are they urban communities? Are they the elderly? Are they women of reproductive age? Who are you trying to serve? Or you are serving everyone? Okay, that's the second part. The third part is how are you going to get the revenue to be able to run the business sustainably? Where are you going to get the funds to procure the equipment, to pay the healthcare workers, and basically make sure that the business runs in a sustainable way. And then we also look at the cost structure. Some of these interventions can be cost intensive, and then we have those that are not highly cost intensive but are highly impactful. So your business model, what does it communicate in terms of cost? Okay, is it a cost intensive business or a low cost business venture? And then the resources that you use, what platforms are you going to use? Is it a digital platform? Is it a physical infrastructure? The human resource, where are they going to be? Are you going to use telemedicine? Are you going to use what you call M-health or digital health? What resources are you going to use? The moment you talk about your business model, do things usually come out naturally. So now let's look at the different health business models, or different business models in healthcare. They will of course vary, because we have seen that healthcare services can be provided in different ways. They can be targeted, they can be those that target the whole community, they can be those that are provided at a community level, there can be those that are provided at secondary or even tertiary level. And there are also different strategies of collecting revenue. So that means that there are several business models in healthcare. And in this presentation, we have about 9 of them. And in our discussion, we actually realized that there will actually be more than these 9. So the first one, which is very common and which everyone is actually rushing for, you could be working with an NGO, and your interest is, after working with this NGO, I'm going to set up a clinic. And that's where everyone is rushing. Setting up a clinic, people come, they get services, then they pay, then they go home. That is what we call fee-for-service model. Okay, it's very easy to operate, it's very easy to communicate. Yeah, the challenge is that there is over-utilization of services. It cannot be very affordable for people of low income status. And then the focus is on rendering more services. The more services you render, the more you can run this facility sustainably. But when the sales go down, in this case, when few clients come in, then that's when issues start to come in terms of running them. Okay, so fee for service is the commonest one, and it's what everyone is rushing through. My message in this presentation is that, please, why don't you think about other unique ways of providing healthcare services? It's my unique message. Why? Because you will be able to achieve the intended, the social entrepreneurship aim, okay, which is basically creating that impact in a community and running your enterprise sustainably in terms of finances, and not running it on a basis of making a lot of profits. Yeah, so the capitation model. So here, in this case, we are having healthcare providers receiving a fixed amount of money per patient that they see, regardless of the number of services that they have actually provided to this patient. So this is common with the insurance companies. You can have, for example, if you're running a healthcare facility, an insurance company comes to you and then they say, for these clients that are insured with us, we want them to receive healthcare services from your facility, but for every patient that comes, we are paying you $50, regardless of what the services that they come and get from you. That is what you call capitation model. Okay, so it is better for preventive medicine care, and also cost control. At least you're not going to have excessive expenditures. Okay, and usually you of course see this in health economics, that when you have people insured, sometimes they tend to overutilize medical services or healthcare services. So in one way or the other, this can actually be useful in curbing the costs. Okay, the challenge is that it discourages provision of specialized care. So the facility owners may not provide care that is specialist in nature and that could be costly, so they end up providing lower level care. Okay, and then it's also an incentive. It's an incentive to reduce service utilization and potentially compromising patient care. So the healthcare facility will be very cautious in dishing out these services to clients if the clients need more services than what the capitation amount actually could cater for. So the capitation model actually does not only work with insurance organizations, but you can also have the government working together with, let us say, non-profit making organizations, or even for-profit making organizations. So you have a private organization that is working together with the government, and then the government gives them some money to make sure that at least the cost is there for there is actually access to medical services in areas where perhaps the government does not have any health facility. Okay, so that is capitation. And then subscription model. We have seen, especially in developing countries, where communities actually get together and they contribute money. It could be monthly, where if someone actually falls sick, they can be taken care of without the need to spend out of pocket, what we call out of pocket payment. So subscription model is basically like insurance. Okay, it's basically like insurance, and we actually sometimes we term that as community insurance schemes or community insurance policies, and this has been actually successful in some parts of sub-Saharan Africa, including Tanzania. I've not heard of community insurance interventions in South Sudan. Perhaps later on you'll share with me experiences in that area. Okay, at least with this, you know that the income will come in, or the revenue will come in, and in a predictable way. So that means that you can be able to manage your costs if you know how many members you expect to have and the nature of services that they can receive. And this has also been used in maternal health, okay, where someone becomes pregnant and then they start to pay money monthly, but the time the 9 months elapse, the delivery is actually free for them because they have been insured, they have been paying. So it is part of what we call birth preparedness in some situations. So that means that subscription models can actually be tailored to the need of the community and the willingness to pay and how much they can actually pay. That's very important. Cross-subsidization, what does this mean? Is that you get profits from one of the services that you provide and then subsidize the other services that you're also providing. And this means that you are basically managing your margins. You keep your margins at a healthy level. This is to me to say that at margins that can allow you to operate such that you don't actually close down. Okay, because if you at the end of the day provide a lot of these services for free and you're not getting enough revenue, it means that you're not running it on a financially sustainable manner or in a financially sustainable manner. So for you to be able to do this type of health service provision, it means that you need to have a number of services that you're providing, what we are terming as diverse service offering. If you're not offering a few services, then it is not going to be very easy for you to subsidize some of the services. So most likely you if there is a service that you're providing and that service is on higher demand and you're having sufficient profits from it, and then other services can actually be subsidized. Issues to do with immunization, for example, can actually be provided for free at private facilities. Differential pricing model. Price is one of the strategies to run your business. If you enter into a business, price differentiation means a lot. It is what can make you different from others. It is what can make you enter into a competition, a business competition. So you can use differential pricing also in healthcare. And in this, if you have a population of high income earners and also a population of low income earners, those that are of a high income status can pay more compared to those of low income status, and therefore that means that you're actually serving both communities or both categories of populations. It is very hard to run primary healthcare services in this manner. It can actually work for secondary services. Okay, so this still actually relates to what we have just described, which is cross-subsidization across services. Okay, with price differentiation or differential price model, we are interested in income levels of the clients. With cross-subsidization, we are interested in subsidizing services based on the profits that we get from a particular service in order to make some essential services more accessible and more affordable to clients. Okay, the advantages are that, of course, you are catering for even the low income earners, so that is actually a plus. And eventually, the underlying benefit is actually you maximize profits because you're getting from the low income earners and also you're getting from the high income earners. So the revenue streams actually increase in that case. It may be very difficult to implement. That means that you really need to make the proper analysis to be able to implement this at different levels, whether primary care or secondary care. Insurance based, I mentioned this earlier on, I think. You pay premium, and then when you fall sick, then you don't pay anything because your insurance is there to cater. Okay, so this is actually related to what we call the subscription model. So financial catastrophe as a concept where if you fall sick, you actually an inch away from entering into the poverty zone. That is financial catastrophe. So you don't want to be there, and that is why insurance actually plays an important role. You can have mandatory public insurance schemes, and I think Kenya is introducing that or has already introduced that, but you can also have private insurance, where the insurance company is actually a privately owned organization, and you are basically having a contract with that insurance organization. Challenge, of course, for our case, we have limited insurance organizations, and like I said earlier on, even community-based insurance schemes are very rare to find. And then for those that are actually operating, for example, in Juba, getting reimbursements is actually very, very tedious work. And sometimes you go to these health facilities and they cannot provide you the services that you want. So you end up spending your own money and eventually having to request for reimbursement. And this is what is actually tedious. And sometimes, of course, health insurance is actually difficult to run because of the risks associated. You can have increased expenditures to the insurance organization. So issues of overbilling and ancillary procedures can actually lead to increasing costs of running insurance organizations because of the maximum claims that can be made. The government coming in, what I earlier on called government contracting, public-private partnerships, where you can be running a health facility and then you go to government, could be the State Ministry of Health, could be National Ministry of Health, and say, I can provide these services if you can be able to provide me this. So public-private partnerships are actually one of the ways in which services can be provided to people who are marginalized. So in this case, government contracts clinics to provide services to the population. These services can include immunization. The advantages is usually private sector players are actually very efficient, yet the government is actually slow in responding. So when we have public-private partnerships, it means that there is a possibility that you're going to have populations receiving services that they need, and these services can be provided in an efficient way, but also quality healthcare services. But this also means that the government is actually ensuring that healthcare services are accessible to everyone, even in areas where governments do not have health facilities. Okay, and it can be very easy to even integrate these privately owned health facilities into the government public healthcare systems. The challenges is that, of course, red tape, what we call red tape, that for you to negotiate a deal and have a partnership with government, it takes long, and often the reason being that this could require approval from the highest level, and usually this is very bureaucratic, but also this can be hindered by government policies and also issues to do with budgetary allocations. Okay, so it's not very easy, but usually, like with other social enterprises, there is a risk of creating what we call parallel systems. What we mean by this is that there is a way of organizing healthcare services in a particular organization, in a particular geographical location or in a particular country. Now, when you're introducing public-private partnerships, you are in a way creating another system of healthcare that is not completely integrated into the national health system. So, for example, if you have a healthcare facility that has signed a partnership deal with the government, how will you streamline all the processes into the national health system? So that is where we are talking about issues of creating parallel systems if they are not well integrated into the public health systems or infrastructure. Value-based healthcare model, this is one of the rarest in our case. Why do I say so? Is that because of the fact that we are interested in clients that come and pay, as long as they pay, the deal is closed. But in this case, we are not only interested in them coming and then them going. We're interested in seeing whether actually the services that you provide to this client resulted into an improvement in health outcomes. If that is not the case, then that means that we are going to ask you questions related to value. We're going to ask you questions related to value of the value of the services that you're providing. So we are not interested in the volume of services. We are interested in how many people came to your facility. We are interested in the people who came for the services that you provide, but did they improve or not? How many got readmitted? The patients who came to you, what do they say about your services? Okay, so we want to get the client perspective, and that is where issues to do with getting feedback from customers about the services that you provide become very important. Okay, so the more you provide quality services, the more you have better health outcomes, then the more you will receive money from the government. Okay, that is if you as a private healthcare provider, you're working with government. Government does not look at how many people you have attended to, but how many people are actually showing that they are improving because they came to you. Okay, so that is a very good incentive for quality and efficiency, and the interest is basically on improving long-term health outcomes rather than short-term health outcomes. So that means that you really need to have very good quality assurance systems, but also good systems of collecting feedback from clients, good systems of collecting health information, because you cannot drive the quality healthcare narrative without proper health information systems. Social enterprises is the last model that we are talking about. Like I said, you're addressing a social problem using innovative ways without the need to maximize profits. Okay, you try to fill in the gaps to make sure that people can get the services that they want, even when the government is taking long to respond. The issue here that you're addressing social and financial issues, very impactful issues that you're trying to address in a business manner that allows you to run the social venture sustainably. Okay, so that means that you can get resources from, it could be from foundations, from NGOs, even from providing the healthcare services. But the ultimate aim is creating that change that you want, social impact, and also making sure that you can sustainably run the business or the venture and also scale it up. Scaling up, meaning that you can increase the business size. Okay, that's what we mean by scaling up. The challenge, like I said, it can create parallel systems, so it can run outside the national regulatory framework. So some of these innovative ways could be ways that do not have regulatory frameworks yet. Maybe the government has not thought about it yet, but this is a solution that you can actually use. So you can have, you can run clinics, you can run hospitals, providing all these services at different levels to different communities. What is very unique is that it should be self-sustaining, unlike what you call charitable clinics, relying only or majorly on donations. Social enterprises use the profits to sustain the operations. So that means that you cannot talk about a health social enterprise if you cannot reinvest the profits, or basically if there is no system of revenue stream because of the services that you provide. Yes, you can get the donations, but not 100% on donations. That's what we basically emphasize here. So you can run this social enterprise in a way that you are reducing costs, such that actually your clients can receive services at an affordable cost. It can be the value that you're actually providing to your clients. Okay, so this can entail issues like, for example, buying directly from a drug manufacturer and then taking them these drugs directly to your clinic. That means you have cut out the middlemen, or even the pharmacies, wholesale pharmacies in between. That means that you can be able to sell these drugs at a rate that is actually very affordable to are very affordable to the population that you're serving. The other way can involve, for example, innovations related to how you can have unique staff that can provide a service, and that service can actually be rendered to the population at a much more reduced cost. Okay, so uh, that means that you can have a unique set of health professionals that perhaps have undergone specialized training. For example, you have interventions where clinical officers are trained in how to use ultrasound. So after training these clinical officers in how to use ultrasound, the ultrasound machine, and then they go to communities with these portable ultrasound machines, it means you're actually availing ultrasound services to communities that could not have received them. Because basically, in our kind of setting, clinical officers are not usually very trained in using the ultrasound. So, but if you train them and then you give them these gadgets and then you mentor them well, it means that you're actually making the service available because of scaling and availing some of these unique tools to make sure that these professionals can do the services that the communities could not have otherwise received. And we are also having programs, for example, where clinic officers are still trained in carrying out obstetric surgeries. Okay, so that means that clinic officers can carry out cesarean sections in different places as well as they are trained. And this is also another example of how you can have services being available to people, basically by reskilling, retraining some of the paramedical staff. Okay, issues to do with diagnostics, issues to do with the house laboratories, in-house laboratories, can be very good ways of leveraging what you call economies of scale. Okay, so for example, if you have a health facility that does not have some of this equipment to carry out these laboratory tests, why not have a system, or even reinvest in profits and have some of this equipment, and then you reduce the cost but also provide the same service even in neighboring facilities, and in such a way you actually cut down costs. Okay, and also, for example, having a set of community health facilities coordinating in using one of the equipment that they could be having, that would be also another way to solve health challenges in communities. Income generation, usually with social enterprises, you have all people paying the same amount of money regardless of their socio-economic status. But you can also run a social enterprise by innovating technologies, health information technologies. It could be an issue to do with mobile apps, it could be a health facility management system, and many things. Also, issues to do with subscriptions can be implemented in social enterprises. For every intervention that you do, make sure that you can measuring the impact. Social impact needs to be measured, so you need to be very good at understanding the metrics that you can use. Sometimes it can be challenging, but M&E, measuring impact, is very important. Patient satisfaction scores, okay, them giving you feedback, them rating the quality of service that you provide, how many people have been reporting, how many people have you handled. These are very important metrics that you can use to evaluate your intervention. Mobile clinics, use of telemedicine can also be ways in which to address some of the challenges that low-income countries actually face in terms of access to patients, and also to access to healthcare, also recruiting more patients into healthcare. Think about making your business large. That is what we call scaling. How do you scale? You can open multiple clinics operating as chains. chains, businesses under the same management opened up in different places. Or if you have a well-known healthcare facility or healthcare business that has already made its name, you can work with them and establish a branch in your community such that when they hear the name, they basically associate it with the main brand, and therefore you basically easily get these sales. That's what we call franchise. Okay, mobile clinics, think about them. Enjoy the benefits of economies of scale by buying in bulk. That's something that I've explained. Centralized laboratory services, something that you can think about. Don't neglect the rural areas. Don't neglect the rural areas. We actually, in our context, we have left the rural areas into the hands of NGOs. Yet you, the public health students and healthcare management students, and any other person who is listening to this lecture, you can be able to provide these services. Okay, so think about these communities, provide these unique services, include technology in your systems, and you'll definitely scale up. Okay. Generally, in other places, we are having a shift in terms of how healthcare businesses are being operated. So, because of the increasing medical costs, there is a shift from fee for service model to innovative models. Okay, to make sure that the costs are actually reduced. So healthcare organizations are becoming more transparent, empowering the customers more, and basically listening to them, providing what we are calling customer or consumer or customer-centered care or patient-centered healthcare. That is where we are moving. The challenges of the traditional, those fee per service models are actually traditional. They're the ones we are referring as traditional here. It's very difficult to measure value, yet our interest now is in terms of quality and also outcomes and also issues to do with patients' preferences and also engaging them. So that means that we are shifting gears to issues to do with results, output, how much we get, and the margins. Okay, that's where we are in terms of running these facilities. Okay, so results are aimed at improving quality, whether clinical quality, service quality, and cost performance. It's no longer about someone says, okay, I gave them a quarter and they are okay. The quality of service that they received. Okay, how did you arrive at that diagnosis of malaria and then you get quarter? That's where we are. And then, yes, the revenues, and I've seen this happen a lot. You leave your work, let us say the contract has ended, you come with your money, you open up a clinic. Within a few days, the business is running well, but over time, there is a decline in the number of patients that visit your clinic, and eventually your clinic actually collapses. Okay, so there's always a decline. It is that decline in fees for service, and that is where sometimes you need to recapitalize. Okay, recapitalize, and for countries where you have governments working with these private providers, then you can have reimbursements, and then you can have these reimbursements can come from even insurance organizations or even government, and these payments can be based on what we earlier on called value-based payments. Okay, but in our case, if you're only going to rely on this fee for service, it's going to be harder for you. Okay, that means that you need to be extremely innovative to be able to run this business. Because I've seen clinics actually collapse here in the capital, Juba. And then margins, after you have invested, and then you have these operational costs, the profits that you actually get, where are you putting them? Okay, where are you reinvesting that money? If you're reinvesting, then perhaps that is a good strategy. It will allow you to improve on the technology that you're employing in your clinic. Most of these clinics actually aren't having any technology they are employing. Everything is paper-based. You can't know the number of patients that are coming in. You can't know the stock in, the stock out. You don't know what is happening. Okay, so technology is actually very important in managing these facilities. And when you introduce new services, what impact are they having on the rest of the services? Are we having an increase in revenue, or the margins are actually improving? So it means that integrating technology is very key. So that marks the end of this presentation.